So you're exploring platelet-rich plasma, or PRP, for a spine condition, and you really just want to know what the whole process actually looks like, right? Well, in this explainer, we're going to cut right through all the noise and give you a clear step-by-step guide. We'll be following the approach of neurosurgeon Dr. Kamal Woods at Vertrae, his spine-only practice right here in Dayton, Ohio.
And this quote from Dr. Woods, it really nails the whole point of our conversation today. This isn't about selling you on some miracle cure. It's about walking you through the real-world experience so you know exactly what to expect, step by step with zero surprises.
So, where does this whole journey even begin? You might think it starts with an injection, but nope. It all starts with something way more important, a really thorough evaluation. Honestly, this is the most critical step in the entire process.
Look, this evaluation is not just about taking a box. It's a filter. The whole goal is to figure out if your specific situation lines up with the patients who've gotten real, lasting results from PRP. If it's a match, fantastic, we move forward. But if it's not, the promise is to tell you that straight up and talk about what other options make more sense. This is all about preventing false hope, not just doing another procedure.
Okay, so let's say you and your doctor decide PRP is absolutely the right path for you. What does the actual procedure day look like? Well, the whole thing is designed to be really straightforward and efficient.
It really boils down to 4 simple stages. First, we do a totally standard blood draw, nothing crazy. Second, that blood gets prepared. Third, and this is the important part, the PRP is injected with pinpoint accuracy. And fourth, you go home the very same day. It's an outpatient thing designed to mess with your life as little as possible.
Let's just zoom in on that for a second. Your own blood is put into a machine called a centrifuge, which spins it for about 15 to 20 minutes to get this super concentrated mix of platelets. Then, and let me be crystal clear, this part is non-negotiable. A live X-ray is used to guide the needle to the exact target in your spine. There is zero guesswork. Precision is everything. And after that, you're good to go home.
All right, next up is maybe the most important topic we'll cover, managing your expectations about how long this actually takes to work. This is where a lot of confusion can happen, so let's just get it all out on the table right now.
So here's the absolute truth. PRP is not like a steroid shot. It is not going to give you immediate relief. It's a biological therapy. It works by signaling your own body to start a repair process, and, well, that process just takes time. Think of it like a marathon, not a sprint. So this is your roadmap. For the first month, you really shouldn't expect much of a change at all, and that's totally normal. The biology is just getting warmed up. The real, meaningful improvements, those usually start to kick in around the 2-month mark. By month 6, that's when you'll likely see the peak benefit. And for people who respond well, these results are really built to last. And that brings us to this number. What happens in the long run? Well, major research shows that 71% of the right patients, the ones who respond to the therapy, are still feeling that success 5 to 9 years later. That's not a Band-Aid, that's a durable, long-term result.
Okay, we've talked about the medicine and the timeline. Now let's get into the practical, real-world questions that every single patient has. What you have to do afterwards, how much it costs, and who is actually a good candidate.
Now this is a big one, and it catches a lot of people by surprise. After your procedure, you're going to be told to avoid things like ibuprofen or Aleve. So why is that? Okay, so here's the simple science behind that rule. PRP kicks off a small, controlled, inflammatory process. That's the signal that tells your body, hey, time to start healing over here. Well, those anti-inflammatory drugs, they work by blocking that exact same signal. So taking an NSAID after PRP is literally like pouring water on the fire you just started to get the healing going. You'd be working against the treatment. And now, for the question that's on everybody's mind. What about the cost? Is insurance going to pay for PRP for a spine issue? The honest answer, at least for right now, is that most insurance plans do not cover it. It's almost always an out-of-pocket cost. And that's precisely why at a practice like Vertrae in Dayton, Ohio, that financial conversation happens right up front during the evaluation. You will know the full cost before you even think about scheduling. No financial surprises, period. So if PRP can work so well, does that mean you can just forget about surgery? Not always. It's really about using the right tool for the right job. PRP is a fantastic option for pain that's coming from a disc that's degenerative but still has life in it. But if you have a major structural problem, like a nerve being severely pinched or your spine is unstable, surgery is still the right fix.
And this quote from Dr. Kamal Woods really just sums it all up perfectly. PRP isn't a Hail Mary you try when everything else has failed. It has a very specific sweet spot where it works best. After you've tried conservative care, but before the damage is so bad that there's nothing left for the PRP to work on. It's a strategic move to preserve your motion and function for the long haul. Which brings us right back to where we started. So how do you know if you're in that ideal window? Well, it all comes back to that one critical first step.
The only way to know for sure is to have a detailed one-on-one evaluation with an expert. If you're near the Dayton, Ohio area, that conversation can happen with Dr. Kamal Woods at Vertrae. Remember, the whole point of that first visit isn't to get you on the schedule for a procedure, it's to get you a clear, honest answer about which path is truly right for you.